I'm Dr. Amanda Ward at Bloom Natural Health. I'm a naturopathic doctor, and this is our Bloom blog. And I'm always talking about our Discovery Lounge here at Bloom, which is where we do a ton of different lab testing. I always joke that we test every secretion you make, blood, urine, stool, saliva, all those things, because we really like to gather, as naturopathic doctors, a lot of data about your body. We believe in individualizing treatment for each person, and everybody's going to have different stuff going on. But my favorite test, and all my patients know this, but my most favorite test of all the ones that we do is called SpectraCell. It is so rad. So it's a blood draw. We draw your blood here in our Discovery Lounge. We ship it to that lab in Houston, and there they grow your cells. It's so cool. They synthesize your DNA. And then intracellularly, or inside of the cell, they can look at all your different nutrient levels, vitamin levels, mineral levels, amino acids, fatty acids, all this cool stuff. And micronutrients are what make up every single thing in our body. So it really helps us get to the root of the root of the root sometimes. So I always like to talk about the most common deficiencies we see, because there's a few of them that show up all the time. Probably the most common deficiency I see across the board is vitamin B12. It's a super critical B vitamin. We need it for making energy, for making red blood cells, making white blood cells. Our entire brain and nervous system need it. So we'll see people with fatigue, depression, numbness and tingling starting to happen in their hands and feet. They'll be anemic because they're not making enough hemoglobin. So that's a common one. Vitamin B5, also called pantothenate, super common as well. That's a super important B vitamin for our immune system, our adrenal glands. We'll see stuff like fatigue, again, will come in. But hair thinning is a common one with pantothenate, and I see that all the time in women. So poor wound healing, rashes, those are other things with pantothenate. Another super common deficiency, which happens to be my most favorite nutrient, is called glutathione. That's an antioxidant that is just a superpower in our body. You need it to detoxify everything, protect our cells from damage. So people will start to get all sorts of toxic headaches and sensitivity to alcohol and things like that when their glutathione levels are low. Vitamin D, super common. I'd say 80% of everybody we test is low in that. Important for moods, immune system. They actually consider it a pro-hormone, not a nutrient, so it can even affect some of our other hormones and things like that. So those are all the most common ones, but there's a ton of other unique ones that will show up for different people and not for other people. So again, I can't say enough as naturopathic doctors how important it is to have a test like SpectraCell, so we can see inside of your cells, literally, what are you deficient in? And then we can use diet changes, lifestyle changes, supplementation, all sorts of amazing things, even injectables to get those levels up. So I love testing, I love SpectraCell. Our Discovery Lounge is so awesome to be able to find out what you're distinctly deficient in. So I can't wait to see it bloom in our Discovery Lounge so we can find out exactly what you need and get you repleted.